So strategies for communication. And when we communicate, and here I am with my hands moving, we use gestures, we use facial expression, touch and visual clues, and all of that we take for granted when we're talking. But it's really important to remember that when you're talking with somebody who has a memory loss, and so that you can follow the conversation about what you're trying to say. Be aware of my body language, because if I'm tense and I'm irritated, maybe because of something that happened out there, had nothing to do with my conversation with the person I'm chatting with, I have to remember that and be aware of my body language. But also, I need to be aware of the person I'm chatting with, because they may be upset about something that has nothing to do with me, but I need to get that out of the way and say, what's wrong? Are you upset? Is there something that I did? Or is there something, to fix? Keeping our tone of voice, or low pitch of our voice is easier to hear, because if my volume goes up, it's a little bit harder to hear what I'm trying to say. So that's an important thing to remember in communication, and communication even with somebody who's wearing a hearing aid. That keeping that tone down can help the communication, because that's what this is all about, communicating well with each other. Watch and wait for the person's response. All of us think and react at different times. So I'm having a conversation, allow the person who I'm talking with to hear what I had to say, and a few minutes to get their thoughts, their words together before they're ready to express what they need to say. So, and again, I'm watching for, facial expression, gestures, and being able to help a little bit in the conversation. Steps to good communication: calm approach, getting attention and maintaining eye contact. That's automatically sends a message that you want to hear. I want to hear what you have to say. So it's really important to maintain eye contact with the person you're chatting with. Keeping it simple, and the simpler and the shorter the conversation, then the easier the understanding. That's what I found. Repeat exactly the same way is very important. Use gestures and visual aids if they are helpful. Like I mentioned there, pass me the red mug. It's kind of directs the person to help be part of the conversation. Wait for a response. Watch and listen, because it's important. You're keeping eye contact, then you're watching as that person goes through the motions of thinking what they're going to say and their expression. And when you start to look for these kind of things, you didn't realize that it's there. And many times in my line of work, I have to do that so that I can get all the information that I need when someone is sick, and where the pain is, and where the headache is, and all those kind of simple things. And remain positive and reassuring is very frustrating for the person who has the memory loss, who's trying to communicate with us what they need to say. So it's really important to be reassuring and positive. And I think my next slide, yes, if you don't understand, it's okay to say that. Could you say that again? Can we try it again? Because you don't want to give the impression you understand what they say, and then you go off and do something totally different than they expected. So that kind of can cause a bit of friction. Try to be non-committal. You don't have to answer right away. You might have to think about what that person had asked or said. Ask questions. And these are things that we would normally do. It's just you have to be more aware of them when you're communicating with somebody who has a. And the other thing that keeps in my mind, somebody who's had a stroke, I would do these things with as well to communicate. Again, it's communicating with whoever I'm talking to. Look for clues in the person's behavior, because they might be trying to get the right word and they can't think of it, but they might use their hands or gestures to get that word that they're trying, and you can help them do that. Give positive feedback with a caring hug and a smile, because we need to communicate that loving, accepting and respectful atmosphere. Include the person in your conversation is really important, because it's easy to, you and I can talk and communicate well, and then the third person might be left out of the conversation. It's really important that there's three of us talking, and not to forget that. Don't talk about the person when they are in the room, instead talk to them. So it's really, and again, that goes back to respect for each other. Promoting abilities. Achieving a balance between independence and assistance. And that can be tricky, and I guess you've experienced that, because you need to encourage independence and but again, give assistance as well. And there is a fine line, and you'll get feedback when you cross the line and they want to do it themselves. And again, we have to remember they're adults, and there's many things that they can do. Need to help the person do as much as possible without doing too much. So taking away that independence is really important, because everybody wants to be part of a family. Everybody wants to be part of an activity, and it makes us feel that belonging feeling to what's going on. Need to encourage remaining abilities and compensate for the lost abilities. Those, be it, they want to make a phone call, well, okay, here's the number. Because that person won't remember that phone number, so why go through the rigmarole when, okay, that's the example that comes to my mind. We don't have to go through that. Oftentimes I'll see a patient and they'll have their drugs listed. So I don't have to say, okay, what medications are you taking, because here's the paper they have with them. So there's lots of ways you can help them feel that they are being part of whatever is happening. Be it setting the table and getting lunch ready, or depending on the person's age, if people are very elderly and they don't have the strength to lift something, well, you get there and help. Say, okay, you take one side and I'll take the other, and we can do this together. Activities of daily living. Instrumental activities of daily living that we kind of don't really think too much about is shopping, preparing meals, managing finances, driving, and using transportation. Activities, so those are the things that help us do our activities. So we can't prepare meals if we don't have our shopping done, and managing the finances, if we don't have money, can't do the shopping. So these things are all interconnected. Activities of daily living are self-care activities: bathing, dressing, eating, grooming. So there's two components really to activities of daily living. General guidelines is do one task at a time. Multitasking and lots of times over the years we've done 2 or 3 things all at the same time. But to avoid frustration, it's important to do one task at a time. If it's time to have breakfast, then we're doing breakfast, having daily bathing or getting dressed, those kind of things. Break activities down into simple steps. And again, it depends on the progression of the illness, of the memory loss or dementia, that you would do this, And every illness progresses at a different rate. Build routines. Be flexible if necessary. Routine is really important. This is what we do, and to prepare a meal, or to what time to take medications, and what time to get ready for going out. Use reminders and clues; those are helpful. Because you want to reduce frustration both on the caregiver and on the person with the illness. So these are little things that can help. Bathing, be prepared with the towel, shampoo, have everything ready. It's all right here. This is what we need. Clues and reminders throughout the bath. Okay, we'll done shampoo, using the soap, we gotta rinse well. So just a little general kind of ease into the conversation. Think safety at all times, handrails, a shower chair, and sometimes there could be a bit of friction if somebody feels that they don't need to have those things, but really, having somebody fall and breaking a bone is not a nice thing. So think safety when you're in that person's home, and there's things that can help, a handrail along the wall of a hallway. Ensure the bathroom is warm temperature before the bath or a shower. Choosing a shower or tub, it depends on the person's routine and depending on their age. Shower if they have trouble with their knees, and I'm thinking my knees stiffen up on me some days. Consider the time of the day too. Some people like to have their shower early and get their day started, and again, you need a routine. Time of day, separating. Sometimes the hair washing can be separate from showering, and handheld shower might be better than the one that's on the shower wall. Again, preference, and you want this bathing should be a good, pleasant experience for everybody. Dressing, again, encouraging independence. Reduce the clutter in someone's closet so they can see, okay, there's the shirts, there's the trousers or skirts, depending. Also the where the socks and things are in the drawer, Give the person choices between which items, what color you want to wear, or choosing clothing that's easy for them to put on and take off. Again, you want to encourage independence so that they can slip things on and not have to hold a whole lot of hooks and buttons and things that, depending on their age, how their finger movements are, because as people get very older, they might have some trouble. Then I look at myself, I have all these lumps. There are some hooks I can't do. Lay clothing out in its proper order is important. Things you put on first, go on top, and then the outer things. So and a lot of times we'll do these things without even thinking ourselves, but you got to keep in mind the person who has the memory loss need help. Try to keep meal times calm and not rushed. As I was saying in my other example, was all the voices around the dining room table and everybody with their own different conversations, but having meal times calm and not being rushed, because a lot of times we can give off feelings that we're in a rush without saying a word. Again, our body language. So we need to be calm too. Reduce clutter, bring out utensils as they're needed, not have them all at the same time. We don't need to have 3 forks and 2 knives, and so keeping things simple. Clues with utensils may be needed as the person's illness advances. Using contrast, so you have your plate, your table, your food, so color is good. Not having everything, say, a brown table, then brown placemat, and so have different colors. Items there can be helpful. Consider types of food that are easy to eat, and whether things are cut up ahead of time, and things that fall apart. I think of fish falls apart so easily. You don't need to use a knife when it's cooked just so. And reduce environmental distractions. Oftentimes having the TV on when it's mealtime might make everybody feel a bit rushed, and we want to have a calmer kind of atmosphere, and food digests well when we're calm and relaxed.